So thanks to all of you who have stuck it out this long. And so, as Bram Zuckerman suggested, there's been some great discussion and some issues that have been raised, which are, as in his terms, are low-hanging fruit and middle-hanging fruit and high-hanging fruit. What will happen from this workshop, as I understand it, and it can be corrected if I'm wrong here, is that the IOM will use the discussion of this workshop and prepare a report that will be independent of the planning committee and Rick and myself. And so we would invite, before we close, any discussions from anything that from the floor at this point. We've had a lot of discussion. Maybe we're all discussed out. But if there's any last minute comments you want to make, now is the time to make them. What Rick and I are thinking about is we will take advantage of this discussion, and based on some notes we take, we can and should, I think, take advantage of this discussion and write a paper or two independent of the IOM, and it can't be claimed as any endorsement by the IOM, but we certainly can follow up on our discussion and write individual white papers or position papers on any topics that come up, and there's been a bunch of them. So I think Rick can comment that we invite you contacting us if you're interested. We may contact you. We need some time, I think, to gather the slides, the presentations, and take a look at everything, because there's been so much good discussion. But so the IOM will produce its report in its own way, in its own timetable. We think that we've got some great ideas, and we'd like to not let those fall through the cracks, and we'd like to follow up on them with you. But Rick, maybe you can add to those.
No, I think that I agree with Dave that what we'll do is just try to get a group of people who are interested in continuing this conversation, both on the panel and also in the audience. And we'll try to assemble that in the next couple weeks when we start to get some information out. I do want to take this time to really thank Claudia Grossman for putting this effort together. She's been wonderful over the last 6 months. It's really the backbone of this entire discussion. I think was really, really good for everybody. So if you can join me in a round of applause for Claudia. And the rest of the IOM staff has been wonderful, Ann and Rebecca and others. So again, it's been a great experience. So with that, the plan will be to keep this alive and to try to assemble our thoughts to come up with some real next steps. I think many people made comments here that the worst thing that can happen is this is a nice 2-day discussion and then we all go back to our regular jobs and not do anything. I think we all found that there was a real compelling need for us to act, that every cliche has been used here. We're at a tipping point, and the other kind of issues. And I think this notion of coming back to whether or not we are going to plan this or let it crash on its own is going to be something we have to basically take some ownership on. So I think there's a lot of energy here to do this, and what we want to do is just move in a kind of staged approach to be able to actually get something accomplished going forward. With that, I think we should open up for just any final burning comments anybody wants to make. Capstone, we've had a lot of summaries so far, but I'll just open up for any kind of final comments.
So yeah, I also want to echo your thanks to Claudia and to the IOM staff for doing a fabulous job. I also want to thank the two of you for terrific work in organizing this conference. You know, one of the when we propose new ideas or new initiatives at NIH, one of the most important things that we often hear is, well, what does the outside community think? And have you obtained input from the outside community that what we're doing here actually makes some sense? I think an important output from this particular meeting is a ratification of the idea that our current business model needs to be re-examined. And if that message comes out really loud and clear from the folks in this room and from IOM, that helps us a great deal in getting things done.
Great comment, Mike.
Yeah, I'd like to, I hope this is not an unwelcome comment, but I did have the feeling that over the course of the day and a half, we began to lose focus on the workshop. That we began with a very clear focus around large, simple trials, and we found ourselves moving towards a discussion of the very complicated trials that are done in the pre-approval period for new molecular entities or for devices, and then to a very rich but somewhat quite different discussion about how to make trials generally more efficient. So we heard a lot about simplification of our complex trials. And in fact, much of what I heard in the previous session about low-hanging fruit was not about large, simple trials at all, but really around trying to make our clinical trial enterprise generally more efficient, a very valuable and worthwhile effort, and one that I think all of us would endorse. But I would hope that as we think about how to summarize this meeting, that we don't lose sight of where in the research ecosystem large, simple trials fit for a particular set of purposes. It's not unnoticed that many of the drivers for this have come from NHLBI and from many of our cardiology colleagues, where large trials have in fact been a really remarkable enterprise that has helped to shape the way in which we manage patients with cardiac disorders. But I did want to make sure that in whatever reporting comes out of this, we don't lose sight of the emphasis on large, simple trials, and that we remain aware there are many areas of medicine where 50,000 patients are not readily available to include in studies, and yet we need to find efficient ways of studying them to advance the care of patients with those diseases.
Thank you for that comment.
Just a note that the Registry of Patient Registries is about to launch. It's sponsored by the Agency of Healthcare Research and Quality. It's built and integrated with clinicaltrials.gov. So soon the national government is giving us an infrastructure to be able to find and locate, and then hopefully we'll be able to even study some of the methods, et cetera, and at some point share standardized data elements and quality measures that are used in observational studies. So if you have a patient registry or registry system, please register that at your national registry.
Is that opportunity disseminated? Because I was not aware of it.
Yeah, there's a marketing campaign that's about to kick off.
Oh, okay. Thank you. Did you want to say something? Yeah. Okay.
Well, where we started off was a welcome on behalf of the IOM, and I'd like to wrap up with a thanks on behalf of the IOM and the National Academies as a whole, and obviously on behalf of both the forum and the roundtable. This has been a really remarkable set of discussions. We started out with a vision of every patient enrolled as a continuous learning contributor, and I think we've made a lot of progress in identifying how that might become a reality in terms of identifying some of the knowledge process aims that are important to engage, some of the strategic elements that are vital if we're going to move in that direction, as well as some of the key issues that need to be resolved. Rather than go through all of those, I have my own list, and I think and hope each of you has your list as well. But it's clear that we have opportunities to advance our capacity in developing what are, in effect, learning-ready records with the meaningful use enterprise that's underway and with identifying the key elements that have to be in those records. We have the opportunity to advance our ability to query those records with the kinds of approaches that were identified in the course of the discussions, whether we call them query learning groups or query triage processes. The fact is that we already are developing the kind of distributed databases that can be built upon to, in effect, develop a global clinical data trust that can be accessed by those of us who are in the knowledge generation business. And we've also had presented to us the opportunity and indeed the reality in many cases already of network interface groups that are beginning to develop protocols on how they can build that kind of global infrastructure that we envision. There are important residual questions around science, around how we can develop the public communication strategies in order to ensure that everybody is working from a common set of reference points, and the sort of leadership engagement at the CEO level and indeed throughout the leadership of all of the institutional stakeholders in order to ensure that what we're talking about becomes a practical reality. There were potential approaches identified in the course of the conversation on each of those issues and on each of the barriers. And we will, as was noted, be developing a summary that lists out some of the opportunities in that respect, obviously emphasizing the fact that we need to change in a fundamental way as a central lesson and take home of the discussions, the way we are going about our business. And so I think that what will grow out of this conversation is not only an important clarion call for change, but a series of very practical observations and suggestions from a strategic perspective that will be enriched not only from the minutes of the discussion and the notes that people have taken, but from other comments that or suggestions that you have between now and the time the report is actually done. And one of the first things that will be coming in your direction and those of the directions of your colleagues who have had to leave is a request for additional reflections and thoughts that you think were struck a chord for you that need to be built into the record of the conversations. Then we will feed back to you those suggestions. By we, I mean Claudia and Ann will, who've been the stewards of the process, and ensure that they are appropriately incorporated in the written record. We'll also keep you informed on any specific follow-up activities. There are several that have been suggested that we can, under the auspices of the forum, under the auspices of the Clinical Effectiveness Innovation Collaborative, that Ralph and Rich chair, be taking up with action plans in the coming weeks and months. So I'd like to loop back again and thank our two chairs, all the members of the Planning Committee, obviously again, Claudia, Ann, and Rebecca and Julia, but in addition, Valerie and Barrett, who have been so effectively stewarding the processes today. So once again, well, word of thanks and applause for each of those who have made this meeting possible. To be continued.